Hello, Sun Devils! This video will discuss cardiac arrest symptoms and how to respond if you encounter a cardiac arrest situation.
Sudden cardiac arrest signs are immediate and life-threatening. People who experience cardiac arrest abruptly lose consciousness and have no pulse.
Take these steps when responding to a potential cardiac arrest victim.
I was like, why are you up that late? It's crazy.
First, confirm the safety of the immediate surroundings.
Make sure the scene is safe for both the rescuers and the victim. Do not enter if the scene is unsafe. Leave the situation and call 911.
After verifying that the scene is safe, check the person's responsiveness.
Moderately tap and squeeze their shoulder while you shout, "Hey, hey, are you okay?" If the victim does not respond, yell for help.
If possible, point at another bystander and direct them to call 911.
If you are alone, call 911 immediately.
Retrieve an automated external defibrillator, or AED, as soon as possible.
Assess the victim's breathing and pulse for a minimum of 5 seconds, but no more than 10 seconds. It is important not to delay cardiopulmonary resuscitation, or CPR.
Check for absent or abnormal breathing by watching the victim's chest rise and fall. Simultaneously, check the carotid pulse by placing your index and middle fingers on the person's neck to the side of their windpipe.
If the victim has a pulse and is breathing, monitor them until emergency responders arrive. If the victim does not have a pulse and is not breathing, begin chest compressions. Cardiopulmonary resuscitation, or CPR, is an emergency procedure that involves repeated compressions on the chest of someone who has suffered cardiac arrest. CPR can help restore the heart's rhythm and keep blood flowing to the brain and other vital organs. Follow these steps when performing CPR on a cardiac arrest victim.
First, position the victim on their back on a firm surface. Next, unbutton or remove the victim's shirt to expose their bare chest before beginning chest compressions. While kneeling beside the victim's shoulders, place the lower palm of your hand over the center of the person's bare chest where the sternum meets the ribs. Place your other hand on top of the first hand and interlock your fingers. Keep your elbows straight and position your shoulders directly above your hands.
Use your upper body weight and not your arm strength as you push straight down with the lower palm of your hand on the victim's chest and compress about 2 inches.
Push hard and fast at a rate of 100 to 120 beats per minute. Allow the chest to spring back or fully recoil after each compression.
Automated external defibrillators, or AEDs, can help save lives during sudden cardiac arrest. Follow these steps when using an AED to provide aid to a pulseless and non-breathing adult.
First, verify that the scene is safe and ensure the person needs help. Delegate tasks to others, if possible. Have someone call 911 and find the nearest AED.
If you are alone, call 911 immediately.
Retrieve an AED before beginning chest compressions. Next, lift the AED lid and turn on the device.
Unit OK.
While providing chest compressions, listen carefully to automatic prompts given by the AED.
Wear gloves if possible. Shears and gloves are in the AED kit.
Inspect the person's bare chest for medication patches. Remove all patches with the gloves from the AED kit and then wipe the chest clean. If chest hair will prevent adequate adhesion to the person's bare chest, quickly shave them using the razor in the AED kit. If working with others, be sure to simultaneously conduct chest compressions.
Attach the AED pads and plug in the connector if necessary. At ASU, all AED pads should have the connectors already plugged in. Follow the instructions on the AED pads for proper pad placement. Place pads around or under any non-removable obstructions, such as a pacemaker. Continue chest compressions until the AED instructs,
Don't touch patient. Analyzing.
When the AED is analyzing, stop compressions and do not touch the patient. If the AED recommends a shock, make sure that no one, including you, is touching the person.
Shock advised. Don't touch patient.
Tell everyone, stand clear. When everyone is clear, press the flashing shock button upon the AED's command.
Press flashing shock button. Shock delivered. Start CPR.
After the shock, immediately resume chest compressions.
If a shock to the person is not advised, continue chest compressions and follow the AED's prompts until emergency medical services arrive.
ASU EMS provides additional CPR and AED resources and services.
Stay safe, Sun Devils!